Hello, everybody. This is Dr. Bob DiMaria with another episode of Ask Dr. Bob from Westlake, Ohio and Naples, Florida. Some really interesting questions. Dr. Bob, I want to know what I could use for losing blood. And you mentioned you've lost about 12 pints in the last 16 months. Well, there's definitely something going on in your body. I don't know if you're male or female, if you have a menstrual cycle or not, you have blood coming out of your rectum, but you'd want to have some blood chemistries done. We'd want to do a CBC with a differential. If you're a female, I'd want to know how your liver is doing. So there's so many possibilities. We actually use a liquid iron very successfully in our practice, but if you're not absorbing nutrients, it's a whole nother issue. But losing that much blood, it's not normal. So we have to get to the cause of the problem. You may consider a personal consultation. We have a very long question here, and it looks to me like the real question is you have some tightness in your feet, and you've been in a lot of places, and you don't know what's going on. So in our practice, we use an OptiChem profile. You could have tightness or fasciitis in your feet because of possible lack of B6, which we can determine by looking at liver enzymes. You may have a calcium phosphorus imbalance, means you don't have enough calcium. You might not have enough globulin in you have too much globulin in your blood, which means you don't have enough digestive enzymes. And if you don't have enough digestive enzymes, you cannot absorb nutrients. Your LDL may be elevated, which tells you might need oil. You say, Dr. Bob, so what are you saying to me? Well, physiologically, there could be a lot of reasons. You talked about structure. So in our practice, we take films of our practice members, our patients standing up, looking at the pelvis. So those are some thoughts. You may want to come to visit me in either Naples, Florida, or in Westlake, or if nothing else, have the OptiChem profile done. Dr. Bob, I have a friend that's very sensitive to lights in stores and churches, etc. This is what I have found. Light sensitivity tells me that you potentially could have adrenal fatigue. We look at blood chemistries, we look at the sodium and potassium level. We also take our patient's blood pressure sitting and standing. Your blood pressure should go up from a sit to a stand position. We also use hair analysis. Oftentimes in the hair analysis, sodium and potassium may be low. You may consider a adrenal stress index to determine exactly how your adrenal glands are doing. Dr. Bob, you had a question. You're asking us about the blood vessels in the back of one's eyes leaking. You know, vitamin C is very important. Red, yellow, and orange bell peppers would be good for that. I would need to look at your CBC and differential just to get an idea of what your blood values are. You know, are you taking medications or not? Interesting questions, but not necessarily easy enough to answer because there's so many possibilities. This was an interesting question also. Your B6 was at 1400, and you said to me that your B6 was really high. So I don't know if you're taking B6 or not, or what else you might be supplementing your body with. Are you taking other B vitamins? So I'd need to have a little bit more information. You may consider a personal consultation so we can determine more what's going on. Very good questions. I have a lot of other possibilities. We're doing our very best to answer them generally to make a difference for everybody. I'm Dr. Bob DiMaria.